For the next heart disease in children, which we'll be looking at, is atrial septal defect. Atrial septal defect in children. Atrial septal defect. So for the atrial septal defect in children, when you say atrial septal, that means what? This like the bridge, okay? Atrial septal defect just simply means the bridge between these top compartments of the heart. So this compartment on this side is the right atrium, the compartment on this side is the left atrium. So there's a connection they have in between. That connection, nothing should be passing through it. So if something can be able to pass through the connection, not connection, the separation, yes, shouldn't be connected, right? The separation, that's like a fence between me and my neighbor. Okay, so me and my neighbor, we mind our businesses. Do you understand? So nobody should be misusing the fence, like throwing things, maybe throwing waste products into each other's house. Do you understand? So if that issue starts up now, then there's actually crazy things coming up. So normally blood should just be flowing one way. Okay. Now if blood is now coming back, the left side handling oxygenated blood, but it's not coming back into the right where it's this deoxygenated blood. Oxygenated blood and deoxygenated blood is now mixing. A lot of issues will come up. So let's look at them. It's a congenital heart condition. That means the baby was born with it. Okay. Now there's an abnormal opening in the walls that separates the heart's two upper chamber. Those are the right atrium and the left atrium. They are not supposed to be communicating, right? So this hole allows oxygen-rich blood from the left atrium to even mix with oxygen-poor blood in the right atrium. So this leads to what? Increased blood flow to the lungs and strain on the heart. Of course, the heart has done a lot of work to clear the oxygenated blood, send it to the lungs to be oxygenated. Now it's not set to send it to the body. But this same oxygenated blood has already been worked upon. It's still coming back. Do you understand? This literally is more of like, it's even applied in our friendships. You are working on your friend, you are always helping your friend. Now that your friend is not actually working, all right, and is always having needs, there's a time you get tired. So you are doing the same work always. Do you understand? I worked on you, you got oxygen, but you are still going back to deoxygenated, so I'll still work on you. I'm getting tired. Do you understand? So types, we have the secundum atrial septal defect. It's more common, occurs in the middle. We have the primum, where is the lower part of the septum. We have the sinus venosus, okay, atrial septal defect. This one is near the veins entering the right atrium. Then the coronary sinus atrial septal defect involves the wall between the coronary sinus and the left atrium. Okay, so this is another picture showing it. All right, you spot out that yellow spot. Okay, so symptoms in children. All right, they are tired, their growth is not fast, they have issues with breathing, they always have issues with respiration, that's infections, heart murmurs, the heart is having some abnormal heartbeats and all of that. Then their heartbeat, of course, is not normal, could be having an extra. Okay, so see another image showing it. Nothing should be passing there. All right, so diagnosis is echocardiography, chest x-rays, electrocardiography, cardiac catheterization. Okay, another image. So I brought beautiful images for you people, right? So treatment options, you can observe if it is too small to see if it will close by itself, but a pediatric cardiologist should always monitor, right? So medication is used to manage symptoms, like medications used to manage arrhythmias. That one we'll talk about it when we start talking about the pharmacology aspect. Device closure, this one they use a catheter to place a closure device. Then sometimes surgical repair, they can just do an open heart surgery just to patch up the defect. Okay, so that's it.